Testing. Okay.
Good afternoon, everyone. I hope you all had a lovely lunch. And we're going to jump right into our next item. So we're at item 5, the 2025 Comprehensive Review. I'll just kind of walk you through how this part of the afternoon is going to take place. Yonggi is going to go through kind of the ground rules for the comprehensive review. Heather is then going to take us through each one of the items, and we'll stop at the end of each and take comments and questions at that point. And then we'll move on to the next one. So without further ado, Yonggi, do you want to take it?
Thanks, Kara. So I will go through the principle, criteria, and the process for the 2025 review. I know probably people have heard and see this, but it's good to repeat this guiding principles and criteria for the 2025 review. Just bear with me, let's just hear one more time because this is super important. The review, the guiding principles of the 2025 comprehensive review, including the review need to take into account investment already made at the national and the international levels, and should not undermine the ongoing efforts. The revised framework should not significantly impose additional burden on national statistical work. There should be space for improvement, while at the same time, the changes are limited in scope, and the size of the framework remain the same. The focus of the common work of the group should remain on the national implementation of the framework in countries for the achievement of the SDG. So this is a guiding principle of the 2025 review. So let me go through the specific criteria for the implementation of the review. Again, so we want to emphasize the aim of the review is to maintain the same number of the indicator currently in the framework and not alter significantly of the original framework. So which, because it's already being implemented in most of the country, and to increase the reporting burden on national statistical system. So this is super important, also kind of like a guiding criteria. And the proposed indicator must have agreed international methodology. Therefore, the tier 3 indicator definitely not considered, and the data are available for at least 40% of the country and the population across the different region where the indicator is relevant, and also be suitable for global monitoring. So this is also important for global monitoring. So taking into the first 2 criteria, and here the detailed, the specific criteria for the different categories. The first additional indicator may be considered only in exceptional cases. When a crucial aspect of the target is not being monitored by the current indicator, or to address a critical or emerging new issue that is not monitored by the existing indicator. A deletion may be considered when the Tier 2 indicator has not able to submit any data to the global SDG monitoring, or is proven to be challenging for country to implement. And the replacement will be proposed if the deleted indicator is the only indicator monitors the corresponding targets. Adjustment or replacement will be considered when the current indicator does not map well over the target or does not track the target well. So this is the specific criteria on the different category of proposals. So additional criteria that's probably you need to remember this during the review process on the sub-indicator. So additional of a sub-indicator within an existing indicator is discouraged, and because it's adds to the reporting burden. Additional, any proposal for replacement or additional indicator should minimize to the use of sub-indicator to ensure the indicator framework does not expand. The IAEG will examine closely our proposal to ensure the reporting burden does not increase as a result of additional sub-indicators. So here is a timeline for the 2025 review. From January to June 2024, the group prepared a review framework noting the possible deletion, replacement, adjustment, addition based on the analysis and assessment of the current indicator framework. During April, the whole month, there's an open call for proposals. So our proposal for indicator for the 2025 review was submitted to USD by the 30th April. And in July and August, open consultation was carried out on a preliminary list of proposals of indicator changes. And from September to October, the group reviewed the result of the consultation and also conduct additional consultation with the consulting agency and partners. And at this meeting, so we're reviewing the draft initial proposal changes to be included in the 2025 comprehensive review. And in December, the very early December, the group will finalize the proposal of the 2025 review and submit it to the UN Statistical Commission for its consideration at the 56th session and in March 2025. So this is a summary of the open call for the 2025 review in April. The open call for period is 1 month, exactly 1 month in April. And we received a total 68 proposal. Among the 68 proposals, 23 are additional proposal. There's no deletion proposal. And there's 3 replacement proposal and 42 revision adjustment proposals. And so we shared with the IAEG member on the 3rd of May. And the IAEG held a 4 meeting during at the end of May and early July to review all these 68 proposals. And so the review process by the IAEG following the open consultation to be included in the global open consultation is the following. And so the purpose is to decide which proposal should be included in the open consultation in July. It was a short listing process for the global consultation. Just want to emphasize, it's not a final decision on the proposals. And the initial criteria the IAEG used was largely based on the methodology soundness, the metadata provided by the submitters. We reviewed the 40% of data availability and also the involvement of the custodian agencies. So, yeah. Okay, here is a flow chart how this 68 submission goes. So Among the 68 submissions we received during the open call for proposal, and the IAEG decided will include 15 proposals for the global open consultation. And 53 of the proposals did not go to global open consultation. Among them, 35 proposals require no action. So the IAEG provided justification for the 35 why they're not considered for the open consultation. All this information is available on the 2025 Comprehensive Review website. And another 18 proposal, the IAEG think it's maybe it's a revision proposal, and they already consulted the custodian agency. This can be also addressed in a separate revision and refinement process. I also mentioned at the meantime, IAEG also looked into the low data coverage of the existing framework, and we identified 32 indicator has a low data coverage and 2 indicator with no data. So we already mentioned the 2 indicator. We'll cover the 32 indicator later. So the global open consultation carried out from 15 July to 15 August. And we announced this on the 2025 Comprehensive Review website, also through the USD social media channel, and we also send this announcement to SDG focal point, like our master mailing list include all the SDG focal point and also all the partners on our list. So we shared the summary of all the 68 proposals received and the rationale for not including some of them in the consultation. For each proposal we included in the consultation, we include the proposed form and also the metadata that submitted by the agency who provided the proposals. So some of the important considerations during the open consultations is anyone can provide comments during the consultation, but if the comment are repeated or of low quality or irrelevant, or will maybe screened out. Not all proposal on the consultation will make to the final list of proposals sent to the Solicitor Commission. And the IAEG will make the final decision based on the content of the proposal, comment received during the consultation, and the size or scope of the final global indicator for work. So it's not one factor is more important. So the IAEG will look at the proposal holistically. So here is a summary of what we received, the feedback we received during the global open consultation. As I mentioned, the open consultation was carried out for 1 month, and there were 15 proposals were included for comments, and we received some 741 individual response during. So this table gave indication the inputs we received for each proposals. And just want to note, for the last proposal, 15.9, UNEP decided to withdraw this proposal, and instead they proposed a refinement. So instead of 15, we reduced to 14 proposals. Among these 14, 7 additional proposals, and 2 replacements, and 5 revision proposal. Try to. Okay. I think it's supposed to be your turn, right?
Oh, we got the camera. Yes. I did that something. Make it work. No.
But I think it's time for Heather to take it over, right?
Yeah. Okay. I was gonna do that.
No, I don't have a mic. That's why.
It's okay. Oh yeah, you're right. I'm gonna be here a while. Okay. Sorry. We do that. Okay, thank you so much. Sorry, We've had a few tech issues, but I think we're there. Yeah. It doesn't like me. I should switch it with the one that didn't work yesterday, right? I think this is a sign. we need a nap.
Okay.
Okay, it works. Okay, great. All right, so we'll start with replacement proposals. There are two. Yeah. Okay. So I just want to explain what is on the slide for each of the proposals. So we include the target information, also the number of indicators in the target, as well as the number of indicators with low data coverage. And then we provide what is the category, replacement, revision, addition, and then also information regarding the proposal, and then information regarding the decision. So we'll just dig right in. So the first one is a replacement proposal from WHO for indicator 3B3. So the current indicator is 3B3, the proportion of health facilities that have a core set of relevant essential medicines available and affordable on a sustainable basis. So the replacement indicator proposal is Health Product Access Index. So the justification for that proposal provided from WHO is that the current indicator is not population-based. It is not updated regularly since it relies on data collections from countries according to the defined methodology for which there is little capacity. And WHO doesn't have the possibility to conduct those facility-based data collections directly. They also note there is limited reporting by countries, and the proposed replacement indicator is a composite index that relies on existing data sources currently part of the established reporting system for WHO. So the IAEG decision is pending and due to more information needed from the custodian. So additionally, the group notes that the replacement proposal appears more complex than the current indicator, including 19 sub-indicators within the index. The IAEG-SDGs require further clarification on data coverage for tracer indicators and the method for calculating the index when tracer data is missing. For example, data coverage for some tracers is as low as 49 countries. The custodian agency will be invited to provide additional information during a virtual meeting on 6 November. And additionally, the low data coverage, which is at 10% for the current indicator, may justify consideration for potential deletion. Pass it back to you, Kara. Thank you.
Thank you, Heather. Okay, so this is where we open the floor. I know that there are some people from WHO, but I don't know if it's the right people in the room to answer the question, but I see a hand up. Are you from WHO? That would be perfect if you would like to take the floor, please.
Thank you. So I'm Haidong Wang from WHO. So although you're right that I'm not from the technical program working on this indicator, but our division and the department, data for and analytics in WHO headquarters, is working with our colleagues in the division MHP closely on this indicator. I do want to clarify that we received additional requests for additional information, and we're preparing to give more detailed information. But based on my knowledge, the data coverage should be exceeding at least 50% of all member states, meaning for us, it's over 50% of 194 countries. I know that because this indicator is part of the new indicators for WHO's GPW 14, the General Program Work 14, as part of the outcome indicators in the impact measurement. So it should have sufficient data coverage. So for additional information, we can get back to you for the virtual meeting on November 6th. Thank you.
Thank you. Do we have other comments or questions regarding this replacement? Okay, as we noted, it's pending, and November 6th, WHO will come to the group and provide us with further information so we can make that decision in time to have the report ready for the commission. Okay, Heather, we'll go to the next
I think there's some more.
screen.
Oh, the screen's off.
And that one.
Oh yeah, this one is working now. Okay, let me make sure. That's where we started. Okay, great. So the second replacement proposal, this is for target 4.6. This is a replacement proposal from Singapore and also from UNESCO UIS. Again, the information on the slide also includes the number of indicators in the target and those with less than 30% data coverage. So we note also the category replacement and also if this is a low data coverage indicator. So the replacement proposal for from Singapore and UNESCO UIS, the current indicator is 461, the proportion of population in a given age group achieving at least a fixed level of proficiency in functional A, literacy, and B, numeracy skills by sex. The replacement indicator proposal is youth adult literacy rate. And the justification for the proposal is that the current indicator relies on costly, complex surveys like the OECD's PIAAC, limiting coverage to higher income countries. Despite efforts to offer a more affordable alternative, such as the mini lamp, it has not gained traction due to financial and capacity demands. Coverage of youth adult literacy rate is higher than 50%. And available for over 140 countries. So the IAEG decision is that they agree to the replacement proposal, noting that the replacement proposal addresses the low data coverage of the current indicator. The proposed replacement is also a well-established indicator with sufficient data coverage meeting the criteria for the 2025 comprehensive review. Pass it back to Kara. Thank you.
Thank you, Heather. We'll open the floor. Does anyone have any comments on the replacement indicator for 4.6.1? Wonderful. We can go to the next one, Heather.
Great. Okay, that was all of the replacements. Okay, now we're moving into the revision proposals. There are 5. The first one is for target 1B. The revision proposal from 1B1 co-custodians UNICEF and Save the Children. The current indicator is 1B1 pro-poor public social spending. And the revision proposal is an adjustment to the indicator to significantly increase global data coverage while also retaining the current definition and indicator name. So the revision proposal suggests to create effectively 2 data series for this indicator. A being the proportion of spending benefiting the poorest 20%, and B, the proportion of spending benefiting the monetary poor, which is the current definition. The justification for the proposal is the new addition A allows custodians to significantly increase data coverage as this data is readily available in various global databases. Both parts of the indicator serve important purposes and complement each other to better understand pro-poor spending. The current definition of pro-poor public social spending focuses on national definitions of monetary poverty, making this measure most relevant to policymakers within countries. So the IAEG decision is that they agree on Part A revision and to delete Part B. So Part B, with the current definition, has low data coverage, 4%, and the revision addresses the low data coverage of the indicator. Specifically, comparable data across all three sectors exists currently for 85 countries globally, covering 72% of the global population, and data for individual sectors exists for 151 countries, covering 94% of the global population. Thank you.
Thank you, Heather. Do we have any comments on this revision proposal and the IAEG decision on this? Okay, I see no hands up. So we will go to the next one, Heather.
Okay, great. So this is for 3.8, target 3.8. This is a revision proposal from 381 custodian WHO. The current indicator is 3.8.1, coverage of essential, health services. The revision proposal is that WHO is proposing the modification of 3 tracers: family planning, health workforce, and management of diabetes. So let me just show you exactly what that looks like. So for instance, on family planning, the current information is percentage of women of reproductive age 15 to 49 years who are married and in union. And the proposal would be proportion of women of reproductive age 15 to 49 years who have their need for family planning satisfied with modern methods. So it's the difference between married and union or versus all women. And then in health force, the change is from health workers, physician, psychiatrist, and surgeon to health workers, medical doctors, nursing, and midwifery personnel. And then management of diabetes from age standardized mean fasting plasma glucose for adults aged 18 years and older to coverage of treatment taking medication for diabetes among adults aged 30 years and over with diabetes, age standardized estimate. So just wanted to clarify exactly what the changes entail. And the justification for the proposal is they're proposing the modification of 3 tracers of indicators which will increase data availability, align with other reporting frameworks, the SDGs and WHO's global program of work, and or improve measurement of treatment coverage. So the IAEG decision is an agreement, agreed to the revision and requests similar information in the footnotes as 371 for family planning. Just a note in that last slide, the rationale for each of these, for instance, the first one from family planning is that it's aligning with the definition of SDG 371. So in relation to this, the IAEG requests that the data on family planning be provided for both categories of women of reproductive age, 15 to 49 years, those who are married in union, and all women. And also request the custodian to ensure that the same footnotes or additional information included for married or in-union data in indicator 371 are also applied here. Thank you.
Excellent. Do we have any comments on the revision proposal for 3.8.1? I believe WHO. Please go ahead.
Thank you. Thanks for agreeing for this revision on the input data for the tracers. We have a separate proposal to this indicator, which is a calculation of the index itself using population weighted mean instead of just equal mean, equal weight for all indicators. Was that included in the review? In the document we send, we have both changes to the tracers and the way to calculate the index itself. So for 3.8.1, there are 14 tracer indicators included. That's part of our proposal as well. Thank you.
We are just checking. Okay, you're ahead of us. That's going to be the next one.
Sorry.
Any other comments or questions? Okay, Heather, do you want to do the next one?
Yes. Okay. Sorry. Let's see. So the next one is, yeah. 3.8 target. Is a revision proposal from 3.8.2 custodian WHO and World Bank. The current indicator is 382, the proportion of population with large household expenditures on health as a share of total household expenditure or income. So the revision proposal, the proposal is to measure the proportion of the population with positive out-of-pocket household expenditure on health exceeding 40% of household discretionary budget. Household discretionary budget is defined as household total consumption expenditure or income net of the societal poverty line. This change is needed to align the global tracking of financial protection adopted for the SDGs with the global tracking that is conducted by both co-custodian agencies. Oh, it's the other one? Okay, sorry. Maybe we should go back to the other one, but I'm not sure. Was it reviewed? Okay.
Is it population?
Okay. It doesn't, I don't think we reviewed the population-based portion of the tracers.
Okay.
So we'll have to review that as well. Let me see. Where were we? I'm sorry. I've lost my mind.
8.8.
This one?
Yeah.
But I thought you said it was 14 tracers.
This is the 14 traces. I had the 14 traces. They revised.
Revising the 3.
But
Got it.
so the calculation.
Okay. 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 So, sorry.
So we'll have to look at the second part of that proposal. The good thing is you're coming on November 6th anyway. So if we have questions, we'll make sure you get them in advance for that one. I think I'll open the floor on the 3.8.2. Perhaps one of the members would like to elaborate a little bit on some of the discussion we had yesterday about the change for this indicator to the 40%. We had a good conversation about it yesterday. Looking at my member colleagues. Okay. Well, I'll talk about it. Yeah, you should never give me a microphone. The IAEG was a little bit concerned about the broadening of this to that extent. It seems like it could be quite a broad change that would increase quite a lot the number that the percentage that had the healthcare costs. So that's one of the reasons we want to talk to WHO. Because it seems like it might make a massive change, and we're not sure if you're still getting the right thing in there. So we would like to have a bit more information from the custodian agency, because we recognize, you said that at the current 10%, I believe, it seems to only look at high income households, but by increasing it by that much and making it of discretionary income, it seems to broaden it a little bit too much. So we require further information on that one. And members, please chip in if I've misunderstood something or miscommunicated our discussion yesterday. WHO has their hand up.
I promise I'll stop raising my hand after this. So for 3.8.2, because our unit works with both our financial hardship department at WHO and World Bank on this indicator, so I know a bit more about the background on the rationale and the data availability. So just on the data availability first, so we have internally done looking at the joint analysis for 3.8.1, which is service coverage index, and also the financial hardship one. The data coverage is there, so we have initial data. So I don't think that should be a major concern. And for the reporting period, my understanding is for service coverage index, we have estimates starting from 2000 all the way to 2022. And similarly for the financial hardship 3.8.2, this new index, they have data all the way up to 2019 or 2020, at least I can confirm. On the rationale why we changed to 40% and specifically on the discretional household income. So through the UHC member state consultation, which we conduct, there is always a concern that currently the 10% or 40% does not capture the true hardship in a lot of developing country settings, and using discretional household income as a denominator has its advantage. So I'll let my colleagues to respond more. I have contacted her already. Maybe I can provide additional information to either today or tomorrow. Thank you.
Thank you very much. Do we have any other comments on this? Okay, I don't see any hands, so we'll move to the next.
Great, thank you so much. The next one is a revision proposals from Brazil IBGE for indicator 392. So the current indicator 392, mortality rate attributed to unsafe water, unsafe sanitation, and lack of hygiene, exposure to unsafe water, sanitation, and hygiene for all WASH services. So this is essentially two revision proposals. One, which is not to include acute respiratory infections in the set of diseases related to inadequate WASH services. And the second one is not to introduce the attributable risk methodology in the calculation, an aspect that was not clear on the previous version of the metadata, and that is explicit now. So the justification for the proposal is that the proposal aims to return to the old methodology before the update in 2022 to calculate the indicator 392. And this implies, one, not to include acute respiratory infections in the set of diseases related to inadequate WASH services, and two, not to include the attributable risk methodology in the calculation. Wait, did I just read that twice? I'm sorry. Apologies. So the response from WHO, WHO considers that neither proposal should be adopted. Regarding proposal one, they note there is strong rationale for including acute respiratory infections among the diseases which can be attributed to unsafe hygiene. And regarding proposal two, WHO recommends to continue to use the comparative risk methodology, which has been used in both rounds of updates to the SDG database. They note that the IBGE suggestion would not be necessarily a return to the old methodology, but would rather be a replacement of the indicator, which has been used throughout the SDG period, with a different one. And then more detailed rationale for each of these points were also provided from WHO. So the IAEG decision, it's pending on proposal one to not include acute respiratory infections in the set because more information is needed from the custodian, and proposal two is not approved. They note that the IAEG will seek additional information from the custodian regarding whether there are adequate benchmarks to measure respiratory deaths attributable to sanitation. Specifically, are all respiratory deaths attributed to sanitation and hygiene, WASH, and how is the share determined? So the custodian will be invited to present this information during an upcoming virtual meeting on the 6th of November. Thank you.
Thank you, Heather. Do we have any comments on this? I see the United Kingdom.
Thank you very much. We're in agreement with the World Health Organization's suggestion to not accept either of the proposals, just based on ARI, acute respiratory infection, doesn't include sanitation, and the mortality rate for ARI is calculated in relation to hygiene alone and not water or sanitation. And alongside that, the comparative risk methodology, as mentioned as well, has been in place since the beginning of the SDG period, so we wouldn't suggest or accept an amendment or removal of it based on that. Thank you.
Thank you. Do we have any other comments? Okay, I don't see any. Heather?
Thank you so much. Last one in this set. The revision proposal for target 9.3. This is a revision proposal from 9.3.1 custodian UNIDO. The current indicator is 931, proportion of small scale industries and total industry value added. And the revision proposal is 931, proportion of small scale industries and total industry value added based on A, international classification, and B, national classifications. So the justification for the proposal is a suggestion to add a series to enhance data coverage. They propose to additionally report SDG indicator 931 based on national classification systems. So the IAEG decision is that this is approved, but they note to the custodian, if a country only collects data based on the international classification, this data should also be included in the national classification data set. Thank you.
Thank you. Do we have any comments on 9.3.1 revision? The United Kingdom.
Very much. More of a comment on, we've already received the survey request on this new proposal and I've responded. I'm not sure if they've jumped the gun or not. It's just a more of a general comment on them sending out the request before it's been sent to the UN Stat Commission. That's all. Thank you.
Okay, who's being naughty? Maybe they had some information that none of us had. Okay, are there any other comments on this revision proposal? Yes, Germany.
On? Yeah. Thank you. In general, we are in favor of this proposal. However, is this really a case for this global revision process? Isn't this just a minor change? Do we really need to bother the Statistical Commission with these classification issues in this indicator? I wonder if we have a kind of limit from when on it's a case for this bigger revision process, and when it's just only changing a definition of a classification or so on within an indicator, that should not go through the entire process.
Thank you, Sven. We have another comment and then we'll take that question.
It's me from UNIDO with us. So of course it's a tiny detail, but if you think about it, if it's an international classification, then it's comparable. But if you use national classification as a definition, the indicators won't be comparable. So it's a very big difference, although it's a tiny difference in definition. So that's why it's good to actually get it approved, I would say.
Yes, before financial aids, I propose to increase technical education for people, because even small industries has some help, financial aid, but it has not good capacity. It will collapse. Technical education in school is not good. It's not in every country, not only underdeveloped. Also in developed countries, technical for workers is not good, and then maybe many enterprises are not cannot sustain themselves.
Thank you for your comment. I think that's a little to the side of the discussion of this indicator, but thank you very much for your comment. Okay, Heather, I think we can move on to the next category.
Great. Thank you so much. Okay, now we move to the addition proposals, for which there are 7. Okay, the first is first edition proposal for target 2.2. This was an addition proposal from Switzerland, FSO, UNICEF, FAO, and other partners. The addition proposal is a suggestion to add prevalence of minimum dietary diversity by population group, children aged 6 to 23.9 months, and non-pregnant women aged 15 to 49 years proportion. The justification for the proposal is that it would fill a critical gap, help interpret progress or stagnation on other SDG targets, inform global development priorities, and allow countries to benchmark their progress on healthy diets. The IAEG decision is that this is a provisionally approved pending further review of the size and scope of the final global indicator framework. They note that the group considers this an important indicator. However, they also note this is 2 additional indicators in a target that already has 3 indicators. Thank you.
Thank you, Heather. Do we have any comments on this proposal for an addition? Okay, I see none. Did you want to make a comment, Sven?
If nobody wants. What does this actually mean? I mean, it's provisionally approved pending further. So we have other indicators pending further. So this is provisionally approved. That means the interagency expert group wants it, but the decision has not yet been taken if it will be inside or not, depending on other developments. And when will the final decision be made by whom?
Thank you, Sven. We've got Moldova over here.
Hello, everyone. My name is Aurelia Spătar. I'm the member of IAEG-SDGs group, and we were discussing indeed even yesterday this indicator. So it is one of the target which has indeed already 3 indicators which have more or less coverage, and there is a new proposal for an addition. And we were also talking about the target, because the target is also covering the elder persons. And here, even if we have already 3 indicators and the 4th one would be also related to children, we do not cover in this target the elderly people. So respectively, somehow we leave them behind in this target. And it is just an example for you to know that we have targets with many good indicators, with good data availability coverage. And on the other hand, we have targets with very few indicators, with very low or even missing data availability. And in particular, those targets are making our overall progress per SDG agenda either in stagnation per respective objective, like I should mention probably the objective 16. We have still problem with that objective on having a lot of indicators, a lot of targets, a lot of indicators, but many of them having low availability or even missing. And from this perspective, I think because this would be the final comprehensive view of the current global set of indicators, we should learn some lessons from this 2030 agenda and take them into consideration for the next after 2030 agenda. Thank you.
Thank you. Is there any other comments? Sven, I'll just respond a little bit more to your question. Oh, FAO, sorry, Valerie, please.
Thank you, Valérie Bizier, FAO. Just to respond to some of the comments from Moldova, in why we're focusing on children and women, it's because first, it's two groups that are quite vulnerable. For instance, in the case of children, diet intakes during infancy impacts growth and development, and see the food preferences, which affect both short and long-term nutrition and health outcomes. While for women, high nutrient needs are compound with other underlying social factors that increase the risk of malnutrition, and such as inequality in intra-household food distribution. The target is about ending all form of malnutrition. So we agree that in the ideal scenario, we would have this indicator for all relevant population groups. The problem is data availability and in some cases, research. So we have, according to research, MDD would be relevant for adolescent 10 to 19 years old. The problem is that we don't have the 40% data availability at the global level to propose it as an additional indicator. In the case of elderly people, 60 years old and plus, we lack research in that area, again, because we lack data to test this, but this is part of the research that will be ongoing. Hopefully we'll be ready by post 2030, and we hope that we will bring actually those indicators under the new food security and nutrition data domain of the UN Statistical Commission. Thank you.
Thank you, Valerie. Sven, I'll just respond. The group decided that because we agreed that it's an important issue, we also note the new domain and that the Statistical Commission agreed to. However, we also noted there's 3 indicators for which the data availability is very good. So we want to look at as a whole. So provisionally we say, well, we think so, but we want to look as a whole at the indicator framework. And Heather's going to allude to a bit more. You know, are we going to, well, are we going to look at the low data availability and think about deleting some of those indicators, which would leave us a bit more room? So we want to take a holistic view. So it will be the IAEG that discusses, and we will decides, and it will be done before the report is due to the Commission. But we recognize it's an important one, but we also recognize there's 3 indicators already, and we just want to look at the whole framework and see where does this review take us, and is there space in it for this one? Does that respond?
That opens probably the room for an additional question. Will there be a discussion to probably delete one of the other 3 indicators to have a limited number here?
We spoke about that yesterday. You know, do we delete something that's in there? And at this point, we're not suggesting that at this point. At this review. Let me be clear, maybe in 2030. Heather, do you want to go to the next one?
Yes, thank you so much. Picking up the wrong thing. Okay, number 2. Gosh, sorry, keep getting. It's target 2.2. Again, this is an addition proposal from the Global Breastfeeding Collective, UNICEF. The addition proposal is a suggestion to add exclusive breastfeeding among infants 0 to 6 months old. And the justification for the proposal suggests adding the indicator into the SDG framework so governments can focus on various actions required to eliminate all forms of malnutrition, including increasing exclusive breastfeeding rates. The IAEG decision is that the addition proposal is not approved. The IAEG-SDGs recognizes the importance of this indicator. However, if the group is to consider adding an indicator to this target, the preference would be for the proposal submitted by the Switzerland FSO and partners. And they also note, given the substantial number of indicators already associated with this target, the IAEG recommends this particular indicator for thematic monitoring. Thank you.
Thank you, Heather. Do we have any comments on this proposal? Okay, I see none. Oh, WHO.
Thank you. I just want to mention that for this indicator, we already have empirical data from 133 out of 194 member states for WHO. And from our work, especially on the mortality side and child health, breastfeeding is essentially really important for child survival and health. And by adding this indicator, we can actually make good progress, at least at the country level, making sure that we achieve the 70% exclusive breastfeeding goal by 2030 to further reduce child mortality around the globe. So WHO is very much supportive of this proposal coming from UNICEF, actually jointly from UNICEF and the WHO. Thank you.
Thank you. And that is noted. You will look on the slide. It does note that we agree that this is an important indicator, but there's lots of important indicators that sit outside of the global indicator framework, and we suggest it goes into a thematic framework. Heather.
Okay, great. Thank you so much. Number 3. So this is an addition proposal from IARD. The current indicator is 352 alcohol per capita consumption aged 15 years and older within a calendar year in liters of pure alcohol. So the addition proposals are adding series to 352, including the prevalence of heavy drinking and alcohol-related mortality. The justification for the proposal was that the sole indicator is insufficient and does not map progress against the SDG 3.5 target, as it focuses solely on per capita consumption and does not measure alcohol-related harms or patterns of drinking. So the custodian agency for 352, WHO provided additional information to the IAEG, and their response was that IARD's proposal does not offer a demonstrable improvement over the existing APC indicator, alcohol per capita consumption, in measuring progress toward SDG 3.5, and therefore should not be accepted. They note that the proposal by IARD, by adding measures on heavy episodic drinking and alcohol-related morbidity and mortality, is problematic for several reasons. The proposed indicators rely on data derived from the current SDG indicator and would not provide new insights. And also note the HED indicator, heavy episodic drinking, faces validity issues and no consistent international definition, among others. So the IAEG decision is that the addition proposal was not approved and that the group was in agreement with the custodian agency response. Thank you.
Thank you, Heather. I see a hand at the back, please.
Hi there, Rob from International Alliance for Responsible Drinking. Just want to get some clarification on the custodian agency response, if I can, because it's the WHO that produces this data. So the WHO has the methodology for heavy episodic drinking and for alcohol-related morbidity and mortality, and it's also agreed as part of the global NCD monitoring framework and the global alcohol action plan by member states. So I'm not 100% clear why there's no methodology available and why indicators that are part of one member state framework can't be part of another one. Just seeking some clarification. Thanks.
So, about substance abuse, I would notice also medicines abuse is dangerous. It is the last proposal from the Istituto Mario Negri from Milano, It's very famous institute about science of nutrition. His president is 95 years old, and that is very healthy. And then he says, because maybe many medicines interact each others, and then they become dangerous instead of making a cure or sanitation. It's also substance abuse. Have you understood? Is my voice coming here?
Maybe you could just quickly repeat yourself. I didn't understand.
This microphone is not good. For example, when people speak in front of you, you can understand. Here at the back, we understand nothing when people in front of you are speaking. I think it's not good, this microphone.
Are there any other comments, or would WHO like to respond to the question that was provided by our colleague? And if you could speak up if people are having problems hearing and online. Thank you.
I can speak to this issue on the technical ground. I think the response listed on the slide is exactly what I got from my colleagues. And I believe my technical colleagues are also online. Dag Revik online, if you can ask him if he can do the online response.
Unfortunately, the people online are not able to they don't have the facilities to allow them to speak. Might I suggest that we take this gentleman's name and we get a response, because I think it's a valid question that he asked and he deserves a response.
My name is Rob Sherwin, and happy to have this conversation outside. That'd be great. Appreciate it.
Okay, we're going to try and let Dan speak.
Yeah, go ahead.
Dag. Dag, can you hear me? And can you we'll try to say something and we'll let you know if we hear you.
Yeah, good afternoon, colleagues, and thank you very much for the possibility to join in here. I was in a parallel meeting and I was listening in, but if I understood the question correctly, was around the methodology of the indicators that are proposed, and secondly, about that they are integrated into other monitoring frameworks that we have in WHO. Is that fairly much the correct understanding of the question?
Yes. Yes, it is.
Okay, thank you very much. So this is basically based on what is available and the methodology, and we are struggling with we report on heavy episodic drinking and mortality and morbidity. We report on that in the global status report on alcohol and health, which is a reporting, a publication that we have basically every 4 or 5 years. The big difference is that APC, total APC, is reported on every single year, and we estimate that. We have a decision tree on how that is calculated. It is first and foremost based on country level reporting, if it is in time series and comparable, and also then we use industry data, we use data from FAO, and we use different types of other estimates in our decision tree. to come up with an estimate of total per capita consumption in each of our member states for every year. When it comes to heavy episodic drinking and mortality and morbidity, that's a much more elaborated exercise where we have some surveys from countries, but they are not conducted every year, and many countries do not have a service that can be used. And as such, we need to use estimations based on APC and also based on situation in neighboring countries. And the same with mortality and morbidity indicators, which are also often based on APC. So as such, we think that this doesn't add any value to include heavy episodic drinking and mortality and morbidity at this stage, even though it's true that we report on these, but not on an annual basis. It is also true that heavy episodic drinking and mortality and morbidity is part of the indicator system together with APC on harmful use of alcohol indicator in the Global Alcohol Action Plan. The original proposal from the Secretariat was only APC, and the first draft of the action plan was only APC because of the reasons I have previously explained. But through political processes, heavy episodic drinking and mortality and morbidity was included. But this is also, again, not reported on an annual basis. So that is currently the situation, and the reason why we think that the addition of these two indicators will not add to the understanding and the progress of the target. And it's also basically just based a lot on the APC. So that is the reason why we think it just creates more work for member states at this stage. And it needs to be developed much more at the member state level to be able to report on that. And as such is not part of the criteria for this comprehensive review either to be included in as two new additional indicators. Thank you very much.
Thank you very much, Dag. Is it okay now? Yeah. Are there any other comments on this indicator? Okay, we will go to the next one, please, Heather.
Yes. Okay. This is number 4. Sorry, just one second. I have to spotlight this. Didn't do it. Okay, great. So this is for target 8.9. This is an addition proposal from UN Tourism to add employed persons in the tourism industries to target 8.9. Justification for the proposal is that it covers a crucial aspect of the SDG target 8.9, currently not monitored employment. So the IAEG decision is that the addition proposal is approved. The IAEG-SDGs worked with the task team on sustainable tourism to develop this proposal, which was also presented earlier today. This indicator is of particular importance for many countries, including SIDS. Thank you.
Thank you, Heather. Do we have any comments or questions about this proposal? Okay, I see none, so we'll go to the next one.
Okay. This next one is for target 8A. This is an addition proposal from the Russia Federal State Statistics Service. The addition proposal was to add merchandise, product concentration and diversification indices of exports and imports annual to target 8.A with UNCTAD as custodian agency. The justification for the proposal is to supplement the existing indicator with the indicator of the level of export diversification with an emphasis on the least developed countries. The IAEG decision is that the addition proposal is not approved. They the group agrees that this is an important indicator that UNCTAD already collects and can be complementary to the framework. Thank you.
Thank you, Heather. Do we have any comments on the proposal for 8A? Okay, I see none. Go to the next one.
Can't even get my notes in. Okay. Okay, so the next one is 10.1. This is an addition proposal from Oxfam. And the addition proposal is to add the Palmer ratio to target 10.1 with the World Bank as custodian agency. And the justification for the proposal is that the sole current indicator does not measure inequality well, and that the Palmer ratio can provide crucial additional evidence on why the shared prosperity target 10.1 is not being met by looking at relative trends in income between the poorest and richest citizens. The IAEG decision is that the addition proposal is not approved. The IAEG group notes that target 10.1 is explicitly about the growth of the bottom 40 relative to the total population, and that the Palmer ratio does not directly capture this, therefore does not address the target. In addition, they note that the very top of income distributions is more difficult to measure than the rest of the distribution due to total and item non-response, making the Palmer ratio more vulnerable to measurement error than certain other inequality indicators. Thank you.
Thank you, Heather. Do we have any comments on the proposal for 10.1? We have to give Heather time to make her notes here. It's okay.
It's all good. Okay. Okay. Oh, we're on the last one. Okay. The addition proposal for 11.1. Yeah. Is from the Ruff Institute of Global Homelessness, and the addition proposal is to add proportion of population experiencing homelessness living on the street or shelters to target 11.1 with the Global Homeless Data Initiative, which is jointly convened by UN Habitat and the Institute of Global Homelessness as custodian agency. So the justification for the proposal is that homelessness is the most extreme form of poverty, social and housing exclusion, and it exists in every country around the world. 78 countries have official data on homelessness. The IAEG decision is that the addition proposal is not approved. The IAEG group acknowledges the significance of this issue. However, they note that the methodology and definition are not yet sufficiently developed for global monitoring. And the group encourages partners to continue refining the methodology. Additionally, the IAEG would like to explore ways to promote further work on this topic through existing UN Statistical Commission groups. Thank you.
Thank you, Heather. Do we have any comments on the proposal for 11.1? Back of the room.
Hi, everyone. I'm Lydia Staes, and I'm with the Institute of Global Homelessness. It's great to be with you all here. Just wanted to provide a little bit more background around the proposal, which is that in 2020, ECOSOC and then the General Assembly passed resolutions on homelessness, the first ever that really called for better data collection and better harmonization on that data for homelessness. And then in 2023, the Secretary General put out his report on homelessness back to the General Assembly, which further expanded on the need for better data collection and harmonization. So we really appreciate the consideration of this proposal, and we definitely understand the decision that the committee took, and really look forward to exploring more ways with you for how we can use other types of monitoring frameworks, because there is such urgency and attention to this issue now at the UN level. Thank you.
Thank you very much. Simon.
Hear me? Thank you very much for the opportunity to comment. The UK did support the amendment, but we do agree with your decision. We, even within the UK, with our four devolved administrations, are encountering difference issues that will present prevent or make it difficult for us to report this. So we do agree with your proposal to kind of work through the existing UN Statistical Commission groups. We have reported homelessness data to the OECD, but again, we've noticed even within those countries that there is significant difference issues and definitional differences that will prevent reporting against this. Thank you.
Thank you, Simon. Any other comments on this proposal? We are just going through these so quickly. I think we're looking at low data coverage now. Heather.
Thank you so much. Actually, before I get there really quickly, in addition to the tier classification review that the IAEG considers every year, they also conduct a review on the framework looking for the low data coverage indicators. It's also part of the 2025 comprehensive review to have a full view of the entire framework. Okay, I'm sorry, I have this in 3 different spots and I'm not looking at the right one. Thank you. So just to note that the Secretariat reached out to custodian agencies of indicators with less than 30% country coverage and requested custodians to provide reasons for low coverage and plans of action to address the issue. So the review of available data was conducted twice, one at Q1 2024 and then at Q3 at the end of September. So we have actually presented a bit on this throughout the year. And originally there were 40 indicators with less than 30% country coverage, but now as of Q3 there are 32 indicators. So there actually has been improvement during this year. So agencies were requested to provide feedback on the following: the rationale for the low data coverage and little improvement over the years, any plan and timeline for filling the data gaps in the near future, and then also any other suggestions on how to address and improve data coverage. So really trying to understand these 3 points for each of the indicators. To note, the IAEG-SDG will follow up with relevant agencies regarding the potential deletion of indicators with low data coverage. So this is a note to everyone. Okay. I won't go through every single one, but the slides include each of the indicators, the custodian agent, very brief summary of the custodian agency comment in general, the number of indicators in the target, the number of indicators with low coverage in that target, and then the percentage of country data since 2015 as of the Q3 SDG database. So this is, there are 32 indicators. You'll note that some of these that are included were part of the 2025 comprehensive review. Either there was a replacement or a revision proposed. And then also earlier when I also mentioned the tier classification, mentioning the 2 that did not have any data, there also are mentioned here. So I'll just not go too quickly, but not too slow either through the slides. Everything, of course, will be uploaded onto the website. And again, the IAEG group will reach out to certain custodians regarding low data coverage for indicators that they want to explore further and have better understanding of the low data coverage and the issues for the indicators. And I'll stop there.
Thank you, Heather. Do we have any comments or questions about the low data coverage? I'm going to start with the member, Pal from Hungary, if you would like to take the floor.
Thanks a lot. Can you hear me? Okay, thank you. Even louder. Okay, is it okay now? Okay, thank you. So the reason why I asked for the flow because of when we went through on these 32 low coverage indicators, I would like to highlight that there are many of them where the target is covered only with those indicators that have a low coverage. That means that those targets are not really measured. So this is something what we have to look after, that these are really important. And since we are on the position of for the last comprehensive review, therefore there's not going to be any more how to say huge sort of change on those indicators. Therefore, it is really important to have something for those targets where there is only those indicators that have just really low coverage. Thank you.
Thank you, Pal. I think Angela had her hand up.
Question is also linked to also the criteria that you mentioned earlier. And because it's something that have been discussed in previous meeting, and I'm wondering if the group also consider as a criteria in terms of all the capacity building that has been undertaken, and particularly for those indicators where there was nothing before. And so with realization that it takes time to build statistical system, I'm wondering if in the criteria that the group has put up, whether it will be considered or is being considered what the point that was made earlier, so that certain targets will not have any indicator, but also for those indicators where really the SDG has started a lot of efforts in building standards and really building capacity, and where now countries are asking assistance to really develop those areas that were not covered. Of course, coming from UNODC, I'm speaking about particularly the areas relating to organized crime, trafficking, etc. But the whole SDG 16 in particular, compared to the other goals, is really probably the weakest. And I'm wondering if consideration will be given to this.
Thank you. We have another hand over here.
Alexandra, UNDP. Just wanted to piggyback on Angela's question, comment, also just to reinforce that in relation to SDG 16, we have also made considerable efforts to fill the data gaps, and we are accelerating the data collection, and we provided a common position and justification, common position across several of the SDG 16 custodian agencies. And just to say, we'll be happy to discuss that. Yep.
Thank you, Alex. Do we have any other? We have Egypt up here in the front.
I think you also need to give more consideration for this list of indicators that are only the one indicators under the target. So some targets here have only one indicator with low data coverage. So more consideration need to be taken for those indicators, not to be proposed for deletion, because otherwise that the target would be left without no more indicators. And also we need to underscore the importance of the investment and the capacity building activities done by the custodian agencies, even if still will not have enough data coverage for those indicators. Thank you.
I'm going to kind of repeat what Imad said because I don't think people heard. But he said that the IAEG needs to take into consideration if there's only one indicator under a target for which there's low data coverage, to be careful not to delete that indicator, because then we would have nothing, and to take note of the capacity building activities that have been undertaken. And I think we recognize that, but this is our last kick at the can. So it's incumbent upon us to take a look at the entirety, including low data availability, and see the plans and the kind of progress that's been made. And maybe there's a way we can help advocate for those. But so I think I captured what you said.
Thank you. Thanks for the excellent work you've all done and in reviewing the indicators. I would just like to reinforce and reiterate again what Angela said and the colleague from UNDP as well, that for some of the indicators, like the one on reproductive autonomy and agency, it's the only indicator measuring that. It's a new indicator, and there's been a lot of effort that has been put. It was never there. It didn't exist. And so I think each indicator has to be looked in its own right and not just a blanket deletion. I know you have explained that you are going to be looking into this. So I hope that there will be a fair judgment and methodology for, ending up with what you delete and what you keep, rather than just a blanket decision, because there are reasons for that, and there's a lot of effort and capacity building that's already ongoing. Thank you.
Thank you so much. And rest assured, we will look very carefully, and we will be cautious.
Thank you, Chair. Robert from UN Habitat. I think just to clarify on your last remarks there, that highlighted that you're going to come back to the custodian agencies to give you more insights or feedback onto the progress that we've been doing. And I know there's the meeting you've also been highlighting on the 6th of November. So I was wondering whether that's the timeline you're working with, or we're going to be working with a different timeline for us to give you additional responses to these indicators. Thank you.
That's an excellent question. As it stands, we probably have a 10-hour meeting on November 6th. So I'm going to suggest we do this in writing. It will have to be done before we submit our report to the Commission. So we will get, well, if you're here and you know you have low data on your indicators, start preparing your response. You know the questions will be coming. So we need to have it done, the review completed before we submit the report, which I believe is due on December 5th. And we have to write it. So we need a little time for that.
Okay, can you hear me? Yeah, thank you. Thank you very much for the presentation, Nicolas Fazel from the Office of the High Commissioner for Human Rights. So I just need also to echo what my colleague from UNODC, UNDP, UNHABITAT said. I think, and I was surprised to see one of the indicator listed there, because I think we provided a complementary information on the conflict-related death. This is an indicator that our organization has been reporting on. This has been in the global reports for a number of years, and dramatically, the trend the last few years has completely been reversed. And we cover data with the highest magnitude of conflict, and data is being collected in very difficult situations. It's very challenging work, but with the creation of these global SDG indicators, there's been a lot of work and still going on in the country. So indeed, thank you very much for looking at this carefully. Thank you.
Mengjia from UFPA. So thank you so much for this presentation. I just have a quick question following up my colleague from UN Habitat, because my understanding is that the custodian agency for those low coverage indicators have already prepared the response to the 3 questions. So I'm just curious what additional information that we can provide to help us to make an informed decision. And is it during the November 6th meeting? Which I'm not sure if we have received the invitation. Thank you.
Thank you. I think when we, as a group, when we discussed it, we want to look at if you can provide us trends. So we have the current reporting is 7%, but is it going up or is it stagnant there? When did it become a tier 2 indicator? Has it been a tier 2 indicator since 2015? If that's the case, we have more of a problem because then we haven't seen a lot of progression since 2015. Has it recently become a tier 2 indicator? Is it a brand new indicator, like Angela had noted? So those are the kind of questions that we'll be asking. So rather than just the amount of the percentage of countries that are reporting, it's how has that reporting changed over the last years, and when did you first start reporting on it, and when did it become a tier 2 indicator? And members, if I've missed anything from our discussion yesterday, please jump in. Okay, I see no other hands or comments. I think it's time for a break. So we have a coffee break until 3:30, and we're only 5 minutes late, so you get 25 minutes. So we'll see you back at 3:30.
Very good. Okay, let's bring the head back to the middle and let's all look up to the ceiling. We're going to stretch the front of the neck. And for the advanced practitioners, you can place your lower teeth on top of your upper teeth. It looks funny, but no one can see you because everyone is looking up. It gives a little more intense stretch. And now we are going to drop the chin once again all the way to the chest bone. This time we can include the hands, gently place them to the back of your head, so we stretch the back of our neck. Very good. Let's look up once again. Let's take another stretch. So first we grow as tall as possible. It's so beautiful to see everyone is participating. I love it. Now we are going to lean to the side. So first stretch, take an inhale, grow tall as much as possible. And try not to move your hips, but just lean to the side. Keep your arms stretched. Very nice. We're going slowly back to the other side. So beautiful. Let's do it once more. So back to the first side, back to the other side. And then we just drop and just shake it out a little. Thank you for playing with me.
Thank you, Agnes. And I have to say, you should all take up synchronized swimming because you are all in unison. It was really beautiful. Okay. Heather is our main attraction again this is after the break, and she's going to run us through the refinements now. So this is kind of the final component of the comprehensive review. We do annual refinements, and this is some of the things that we've been working on. Heather.
Thank you so much. Last one, promise. Okay, so it doesn't like me.
Right? No?
Should I try the other one that doesn't work? Kidding. Because I messed with it, huh? Sorry. Oh wait, is it? No, it is on. I'll do it again. Okay. On, off. Always, right? Okay. So, as Kara mentioned, there are annual refinements that the IAEG reviews. And just as a reminder, the criteria for annual refinements of the SDG indicators is to specify or correct a unit of measure, clarification of terms used in the indicator, spelling or other editorial changes, and then any other minor issues that do not substantively change the indicator meaning. Just as a note for this particular batch of refinements this year, many of the refinements actually were a result of the 2025 comprehensive review or feedback from it. So there are 4 refinement proposals, as Youngie mentioned this morning. 1591 proposal originally from UNEP was part of the 2025 comprehensive review, listed as a revision. So that was withdrawn, and then the agency proposed just a refinement. So this is essentially just updating the indicator to better reflect the current global biodiversity framework. So this is just, as you can see in the current indicator name on the left-hand side in red, and then on the right-hand side, the refinement proposal in green, the changes that they are proposing. And the next one is 1771, total amount of funding for developing countries. The addition is to add and developed countries. So 1771 came through as a metadata update proposal, and the request was to add and developed name as part of that approved metadata update. This next one is 10.4.2. The current indicator name is redistributive impact of fiscal policy, and the refinement proposal is 10.4.2 redistributive impact of fiscal policy on the Gini index. The purpose of this change would be to make it clearer that the data contains Gini indices, and also hopes to address some of the feedback that was received during the 2025 comprehensive review. And the last one is 252, the proportion of local breeds classified as being at risk of extinction. The refinement is the addition of and transboundary breeds. This is part of a metadata update, which is still pending. So for the decision on these refinements, the IAEG approved the refinement proposals for the first three, 1591, 1771, and 1042. And then they have decided to classify 252 refinement proposal actually as a revision because there's a change in the data, but this in the metadata, but this is still pending review. So just to note that. And then additionally, we have a few others pending. There was a lot of feedback from Singapore on ODA related indicators, and OECD is reviewing this. It actually covered quite a few indicators. Generally, this will just lead to some changes in the metadata, some minor refinement changes to the metadata to clarify the definitions on the ODA related indicators, and then potentially could also have a couple refinements, but we're still pending. OECD is still working on this. And then 1791, there was a request from UNCTAD that is also being followed up with OECD to better clarify in the indicator name the ODA actually, which is not clear in the indicator name. So those are the pending refinements. And I just have one more slide. This was actually what Kara was mentioning. This, so just wanted to put into this PowerPoint that the final stage here is essentially in October. Currently, the IAEG, the group is reviewing all inputs systematically and making initial decisions here during the 15th IAEG meeting on the 2025 comprehensive review. And so the plan is that in November, they'll finalize this review and get it ready for the report. And I'm done. Thank you so much.
Thank you very much, Heather. It was a lot to go through, and you did it wonderfully. Okay, we now will have a presentation from Robert from UN Habitat on indicator 11.C. Robert, would you like to come up to the podium, please?
Okay, super. So good afternoon. I'm definitely not here for another yoga class, but for something more exciting as well. Very quickly, I think this is for the target 11C. This is a target that has been around for the last almost 9 years, but we did struggle in terms of the indicator to monitor this specific target. So initially we did have the target as proportion of financial support to least developed countries that is allocated to the construction and retrofitting of sustainable, resilient and resource efficient buildings utilizing local materials. We did struggle to support countries to report on these specific indicators originally designed. And after that, it was dropped. And we've had a couple of years in between where we didn't have any indicator that is monitoring this specific target. So we've been working with a larger set of partners and stakeholders as part of a larger family of many housing indicators as part of the UN Habitat portfolio of course, measuring housing, knowing housing today is a big crisis. And of course, that's why even the homelessness indicator came in. And we know, for example, as well, that a lot of infrastructure in terms of urban, including housing and buildings in urban areas, is yet to be built if the infrastructure we're going to work with in the next 100 years or so. So this indicator is so important that we still come up with something that can help us monitor at least the remaining 5 years of this specific target. So the proposal, of course, after so many expert group consultations and many conversations, was to look at the side of the ODA. So the currently proposed indicator is total official development assistance and other official flows in support of urban infrastructure or urban infrastructure projects. But of course, this needs to be disaggregated by various sectors. The other complementary indicators that the group also looked at were quite a longer list, but we narrowed this down to about 4 of them, of which the second one here is the one that relates very much to the ODA component. But we did look and consider, for example, the percentage of buildings constructed using local materials, or the component that would perhaps just emphasize the aspect of monitoring the capacity development that is going into supporting countries and systems that facilitate building sustainably, and of course also the component of just looking at the share of buildings that are deemed to be very much resilient. So we did consider quite a number of them, but because of the very strict and tight criteria for the because of a very strict criteria of reconsidering indicators to come in for the next 5 years, particularly where they should be data ready, there should be enough coverage, there should be some sort of stronger capacity that exists. That's why all those other indicators were not considered. We had to come back to the one that is more closer to the ODA. So of course, in terms of the other relationships between this specific target and the proposed indicator and the other SDG targets, we do have many of those that connect to the SDG 11 core indicators, some of them, but also this target connects very well to quite a number of other goals. So for example, goal 9 on the industrial component, innovation and infrastructure, definitely, but it also connects the element of poverty. And again, we see this perhaps in the homelessness and the housing crisis as well, but also on the climate action, goal 13 is also very much connected to that because of the aspect of ensuring buildings that are very much resilient. So of course, the justification is very clear that if you do invest into the use of local materials for our urban construction, it's not only ecologically sustainable, it offers many opportunities for economic growth at that local level. It also makes it more affordable, but also speaks very direct about the component of the cultural adequacy in terms of how we build our cities, but at the same time becomes very friendly in terms of creating the green jobs as well as the climate resilience component. So in terms of rationale, that is very clear. Status-wise, we've looked at quite a number of global data sets. This is in collaboration with many partners, including OECD, and there's quite a number of good structured data sets that are available, particularly where you can dissect and look at components of what goes into supporting infrastructure in the developing world. The challenge, of course, is that a lot of the financing that goes in there does not connect directly to the construction industry per se, or to the support of the building materials that are sourced and produced locally. Instead, what you find that the financing sometimes goes into sectors. It might be in education, and then it's the infrastructure earmarked for education, or sometimes it's through the health sector. So we've been doing a lot of homework in terms of dissecting all these numbers to pull out what is adequately aligned with the component of infrastructure, but then isolating out what is for the urban component. So that's the homework we've tried to do, and through that process, we're able to find that at least 82 countries can be serviced from this sort of indicator, where we can isolate very well the financing that goes into urban infrastructure. But of course, in a few exceptions, you're able also to dissect that and pick a few sectors here and there that can, of course, give you more disaggregated data. So that's why for the interim, our proposal was to work with this new indicator and allow us, of course, to refine the current metadata that we already developed, put the data sets together with the anticipation that in the next 3 months or 6 months, we'll have more comprehensive data coming in, at least for these 82 countries initially, and then grow those numbers in the next couple of years to make sure that this target is adequately reported on. So with those remarks, I pause there and hand over the floor back to your chair. Thank you.
Thank you very much, Robert. I would like to open the floor to questions to Robert and any questions you might have on the revisions that Heather presented just before. We have a question over here.
Okay, thank you. My name is Rosa Mamouye from African Development Bank. I have a question for Robert about the use of ODA. What's the assumption behind it? I mean, we are sure, for example, if it was budget of the country, it's there, but ODA, it's not a sure thing. And also what it measures is the indicator we presented, it measures how ODA is used instead of how urbanization is going or how domestic industries are being encouraged, or sustainability for that matter. Just want to know what's the assumption or the idea behind. Thank you.
We'll take a few questions. So we've got one right beside here.
Work now? Okay. Thanks, Robert, for this very informative presentation about this indicator. So as we have discussed before through the set of virtual meetings in the lead up to this in-person one, so how do you guys evaluate the impact of ODA related expenditures on these indicators? If you say it's challengeable to track the spending on construction because it's funneled through other sectors. And you said it's the current data structure is very challenging. What are the possible ways to navigate through this challenge with the custodian agency and how to reflect the importance of using local materials in terms of the ODA spending on those kind of urban construction materials? I think you got it, Cara.
I hope Robert got it because I didn't. I'm a little bit hard of hearing. I will take one more question. We had one more here, and then we'll ask Robert to respond.
Thank you. My name is Boyan from UNCTAD. I have a question essentially that links to the question by the African Development Bank. So the first one is, why ODA? I suspect there is a practical reason behind it, which is data should or are available. But you do mention another thing, which says ODA and other official flows. Can you elaborate on this a little bit more? I would just like to understand what the official flows are. And do you also consider non-financial parts as well? I'm speaking on from the perspective of a custodian agency for the South-South cooperation. And I think this one is how should I say, at least conceptually an important element to bring in, even though, as I will be explaining in a little while, we are not there with the data yet. But I would be happy to learn more. Thanks.
Robert, over to you.
Okay, so thanks a lot. Maybe perhaps just to start off with the very last one from UNCTAD. Why ODA? As I noted, we looked at quite a number of options and there were very good candidates, but the limitation was very much the data that's available. So yes, good indicators, more suitable indicators, but in the absence of data, they wouldn't qualify to support the indicator. So that's why the ODA one was ticking a bit of those boxes. And of course, the idea of considering the other financial flows was the aspect, of course, coming in from the literature, but also the additional homework we did, that for the construction sector, this was receiving financing both from ODA that is earmarked through certain sectors. As I noted, it's either, for example, coming in from health or education, but the infrastructure ends up going into urban areas. But there was also additional infrastructure that comes in through other flows, particularly through the NGO world and other communities that was also coming in, but was not adequately, being tapped by ODA. So that's why the other official flows were also noted as equally important, particularly for the construction sector. And of course, we did evaluate all these options, to see what is more suitable, including, dissecting the data. The current official tables that we do have, for some countries, they report slightly more. So you're able to pull out layers by sectors and be able to see this is the closest. But for the others, it's not. That's why we are working at a higher level in terms of financing that has come through for infrastructure. And of course, if you're interested in the lower analysis, that is available for some countries, but literally not for all. But again, to make sure that we get enough coverage of countries for this indicator, we've stayed very much at the higher level, which is the ODA and the other official flows. Then for the evaluation component, we've done a bit of that again to look at the pluses and the minuses and looked at many different countries. The idea here, of course, the target itself is asking for flows that are coming from the developed world coming into the developing world. And that alone gives you a very smaller sample that you're working with. But even within that sample, you have this challenge that the data itself is not aligned with the infrastructure in terms of urban that we are looking for. So that variation of all these different data sets is a limitation that we've also acknowledged in the metadata. And plus, of course, many other limitations, including, for example, even by sectors. Some might come in, maybe it's financing for vaccinations, but instead it's building an infrastructure project. So it's sort of lost in the language of how it's financed, but in the end you find actually this is an infrastructure project. So it's inherently coming in with all those challenges. But if you stay at the higher level again, that this is earmarked, ticked off as infrastructure support, and it goes into an urban area, then we are able to pick it up, at least at that level. And of course, for the many other assumptions here, there are quite a number of assumptions we've looked at, including, as I noted, we looked at many possible indicators, but ODA is most suitable for now. Not that it's the right one, but at least it's the most suitable one to support this target if we are to carry it forward. Otherwise, the other indicators are also more suitable, but we have to start afresh in terms of building the capacity of countries, collecting the data all afresh. And I think for the 5-year window that we are left with, this wouldn't be a pass at the IAEG-SDGs. Thank you.
Thank you very much, Robert. Are there any other questions for either Heather or Robert? I don't see any. So I think that ends this item. And we are on to item 6, SDG monitoring and indicator implementation. And, oh, yay. Our moderator is really our IAEG member from Moldova. So I'd invite her to the floor. Are we going to invite all the presenters up? Well, Arila is the moderator, so let her.
If the 4 presenters would like to come up to the stage for this session, we'll just have you up here and then we can run through the presentations and have questions. So Boyan, my lovely friend over here, Angela, who's left? Naoto. Yeah, great. Excellent.
Hello, dear colleagues. My name is Aurela Spataro. I'm representing the Republic of Moldova. I'm the Deputy General Director of the National Bureau of Statistics and the member of IAEG. And our colleagues from UNSD proposed us to share the rules of moderation of these sessions. So with your permission, I will moderate this session. Indeed, from the very morning, we had different sessions, and we have been told about the progress by countries being reported under the SDG Global Report 2024. We have heard about the results of the working groups and the task forces of the IAEG. We have heard about the results and the activity of the 2025 comprehensive review of SDG monitoring framework, but also about the joint work together with the whole community on revising these proposals and taking decisions by IAEG on the set of indicators. So now with this session, in fact, we are starting a round of sessions where our colleagues from the countries, from the international organizations, from our custodian agencies will have the opportunities to present their experience and their efforts being undertaken. And we know that all these efforts are very big and they last a long time, involving different partnerships. So during this session, which is called SDG Monitoring and Indicator Implementation, we will have 4 presentations being presented by our colleagues from 4 custodian agencies. And the first, so these presentations will will contain, in fact, information about the measurement and monitoring of 4 goals, the goal number 1, goal number 5, 16, and 17. So just to keep on time, I will ask also our speakers to keep the minutes and the time being allocated by our organizers, about 8 minutes per speaker. And our first presentation is about the concepts and methods in measuring the SDGs 16 through the indicator 1641 on illicit financial flows. And our dear colleagues from the UN Trade and Development, Mr. Boyan Nastaf and Mrs. Angela Mee from United Nations Office of Drugs and Crime. Thank you. Please, the floor is yours.
Thank you very much. I'm going to stand up because I think we've been sitting the entire day. Anyway, so allow us those few minutes to walk you through the SDG indicator 16.4.1, where UNODC, so UN Office on Drugs and Crime, Angela being here, and myself from UN Trade and Development, or UNCTAD, where we are the custodians of this indicator. So essentially some fancy stuff. Okay, so I'd like to give you a bit of a background just to put the status of the SDG indicator. You might have noticed this indicator up in the slides of when Heather was saying like where we don't have enough data and what was going on essentially behind the SDG indicator 16.4.1. So back in 2017, when UNCTAD and UNODC were asked to be custodians of that indicator, there was no definition, there was no concept, there was no data, there was no methodology about illicit financial flows. So what the custodians agencies did, they launched the global expert consultation through setting up the international task force on statistical measurement of illicit financial flows. A couple of years later, concretely in 2020, it resulted in a conceptual framework for the measurement of IFFs. And this was then endorsed at the Statistical Commission a couple of years ago. And essentially with this, we got the first definition of statistical measurement of illicit financial flows for the SDG indicator 1641. And this was actually a very important element that started on the global collaborative process on measuring. And just last year, the General Assembly invited all the entities that are working on illicit financial flows to work in close collaboration with the custodians, so on the agreed concepts and tested methods, to ensure that we are talking and measuring the same thing, because this is important in essentially moving forward. So what we have done together with the UNODC and our partners, usually the UN regional commissions, in years from 2018 up to 2022, in various projects, we have been working in 22 different countries across the globe to test the methods and the concepts. And some of those countries have resulted in preliminary or first official estimates of illicit financial flows. Now, you can see up there that we are actually working in developing countries only. So no developed countries has actually attempted to measure this SDG indicator. We're not going to go into details why and how, but this is, I think, is an important policy or political, let's say, message in itself. So what is important from our end right now is that we are currently working with 14 countries to essentially further refine the methods and to come up with refined results, that is estimates of illicit financial flows for the SDG indicator. Now, we don't have time to go into details of the illicit financial flows, but roughly it can be split into two parts. UNCTAD is taking care of the, it says the tax and commercial illicit financial flows. So in here we have three main categories. One is the tax evasion, one is the trade misinvoicing, and the third one is the so-called aggressive tax avoidance, which actually means profit shifting by multinational enterprises. Now, this last part is very important for the 2030 development agenda. And this is where we have had some challenges in understanding what illicit stands for. It is not illegal financial flows, but it is illicit. This does cause some challenges in some languages, notably Slavic languages, where there is no word for illicit. So, but let's leave all these challenges aside. So essentially what we're doing in the countries, we are really supporting a country-led and country-owned process, whereby national institutions are brought up together to the table to discuss their data availability, their risks, and their potential to apply various methods, and then guide them through the end to actually be able to compile and disseminate statistics on illicit financial flows. So with this, I'm going to turn on to my partner in crime, Angela.
Thank you. Well, Boyan said that they focus on the illicit well, we actually focus on the illegal. And so we take all the part that relates to actually the illegal and, sorry, yeah, and you can see also that in terms of illegal, there are three components: illegal markets, what we call illegal markets, for example, drugs, trafficking in persons, smuggling of migrants, firearm trafficking, you name it, and then corruption and exploitation type and terrorism finance. So what we have done so far, we have published data for 9 countries, and you see there the list that are also the ones that have possibly, among the higher level of illicit financial flow, particularly relating to drugs. But then we have also, in some of these countries, we have also estimated, together, of course, with the countries, illicit financial flows relating to some smuggling of migrants and trafficking in person. When I say we have developed together is that to estimate illicit financial flow, one country alone cannot estimate it, because it really requires really an intensive, if you want, international cooperation, as it was said this morning in terms of statistics, because it's really here an effort to bring data from different countries to try to estimate what is going through a country, being drugs, being people that are trafficked, and this can be done only triangulating information that comes from different countries. So that's why when I say we, because really requires an international effort for each country to estimate. But we are also working now soon. We will have many more than 9 countries. We are working with what we call the Balkan route. That means with all the countries, and will be almost 30 countries, of the heroin and methamphetamine that go from Afghanistan toward Western Europe. And for all of these countries, we are estimating basically the illicit financial flows relating to profit of heroin and methamphetamine. We are also working with Costa Rica at the request of the Costa Rican government because they really wanted to estimate the amount of illicit financial flows, particularly relating to cocaine and cannabis. But we are also working with other countries in a project, what we call DA, Development Account Project, that includes 9 countries from different regions, Africa, Latin America, and Asia. And just maybe to comment on the difference also with the trade, I think it is important also to estimate illicit financial flows for high-income countries. There is actually a lot of illegal illicit financial flows also in rich countries. So here is just to show that the data that we have already published that is in the SDG indicators, and again, possibly next year or the year after, we'll possibly have more. So here, just to conclude, to make a pitch in a way, of why is important this indicator. As Boyan said, the General Assembly said, and there is now countries at the General Assembly are now discussing a new resolution where really specifically they're asking assistance on measuring illicit financial flows and measure this indicator. And then we have also done together a survey to countries, and as you can see here, more than 14 countries really said that they need assistance. So there is really a very large policy need. And so what we are now focusing is, crystallize the methodology and the measurement really to support the countries, but we also need a lot of advocacy and really to show, to understand and to see also that for countries to understand how the data that we can produce can really change policies. And so with that, we really hope that we have made our case. Thank you. We rest our case.
Thank you very much, dear presenters Angela and Boyan. It is indeed an interesting indicator, and now we understand the challenges you have in measuring it, because it is about flow, but this flow does not stop at the border of the country. So respectively, you need the cooperation between these countries and interaction between national statistical systems in order to make provision of qualitative data. So the next presentation would be on behalf of the same speaker, Boyan Nastav. So the topic would be the measuring South-South cooperation for SDG indicator 17.3.1.
Yeah, me again. I'm sorry. But I'll try and be brief. I was told I have 8 hours to go through this, right? No? Minutes? Tomato, tomato. Anyway, so SDG indicator 17.3.1 has 2 custodians. One is UNCTAD and one is OECD. Well, formally, it's not OECD anymore. It is the International Forum for TOSD, which is Total Official Support for Sustainable Development. So just something to put into Robert's mind as well. I'm sure you're aware of it, but this is something where we are actually working together with the OECD, with the TOSD people, on aligning the data that feed into the SDG indicator 17.3.1. Now, that indicator has several sub-series. One is the foreign direct investments, and then are like official flows, private funds, and so on. Where UNCTAD comes in is on the question of the South-South cooperation. So UNCTAD has been mandated to collect data on South-South cooperation and report it to that indicator, while OECD or the TOSD is mandated to report North-South cooperation data. So data are reported already for the North-South cooperation, but for the South-South cooperation, we do not at this moment yet have the data reported to the SDG indicator. But just maybe a word on this. So what is South-South cooperation? So it extends beyond the traditional, let's say, form of cooperation that really links to the economic part and the financial aspects. It really encompasses everything. It looks at the political aspects, it looks at the social, cultural environment, and so on. It is grounded in solidarity. So this is really the base of the South-South cooperation. And even though it is so important, this is one of the very few aspects of the support for sustainable development that is not being systematically measured. There is really a lack of data, but there is also like questionable concepts that have been put in the past that we're not really sure how things are going. And this is actually hampering strategic management of resources. And in order to essentially get to a point where we know what we're measuring and how we're measuring on the South-South cooperation, we need internationally coordinated and supported process, also to avoid any duplication of efforts and ineffective measurements. we do have some early data from the pilots. We are working as co-custodian on the methodologies, and some of the early data do confirm that essentially South-South cooperation in all its form, but specifically on the non-financial flows, is actually a crucial one. And what we also observe is that there's a growing interest from the countries to actually look for the South-South cooperation and try and measure it, and also build it into their policies. Now, we have, similarly as in our previous exercise together with UNODC, we have also conducted a survey among the Southern countries to essentially see what is the status with regard to the South-South cooperation. So are they measuring? Would they be willing to measure it, and what they would need? Majority of the countries said, yes, we are willing and we want to measure it and we want to report it in the next coming year or maybe two, but we need your support. We need guidance, we need materials, we need tools. So we are, of course, addressing this very strong user request, let's put it this way, in the official statistics point of view. And this is where we see that there is a need for this support. And what this support actually entails are two elements. One is the concepts, one is the methods. While the conceptual part is identified, let's put it this way, in the framework to measure South-South cooperation. And this framework has been adopted a couple of years ago, so in 2022, when this indicator was refined. And it is called, and it was developed by the South and for the South. And UNCTAD was invited to act as a custodian and as a secretariat to this process. But essentially, this framework defines or divides South-South cooperation into two major branches. One is the financial support, which is something that we know all about, so to say, and the non-financial part. And the non-financial part is then further broken down into monetized, which is something we as statisticians love working with. But then there's also the tricky part, the non-monetized support. Countries need it, countries want it, and this is why we are now struggling essentially to provide methodological guidance to encompass all of those flows to be then reported. Now, we are currently working on the manual for this framework, including with the tools, the data collection, and so on. So the manual is really translating the framework into the actual work in the countries on data collection, on data validation, and finally reporting also to the SDG indicator 17.3.1. I'm happy to report that we are in the final stage. Within the next few weeks, we should have version 2 of the manual ready to be published and then used for the pilot testing. And we do expect the first numbers to be reported, so for the South-South cooperation for the SDG indicator in the year 2025. Let me conclude with a few words that experts that met a couple of months ago in June. We had a second meeting of the experts on measurement of South-South cooperation in Doha. And essentially, there was a lot of unity on that meeting that South-South cooperation is needed, is crucial, and we need to actually put it to the measurement phase, and then, of course, bring it on to the impact analysis and the policy. So obviously, we see development, solidarity, data, and partnership as keywords. Thank you.
Thank you very much. Thank you very much, Mr. Boyan, for this good news and a detailed update on outputs you have already in place. So we have a framework, a manual, and tools, and we are expecting data reporting on 2025. It will help us to complement our data availability. So the next presentation would be about the indicators related to the government finance statistics, which is measured through 3 indicators, 1A2 and 17172. And our speaker is Mr. Naoto Osawa. Please, the floor is yours.
Thank you, Tara. And thank you to the organizers for this wonderful occasion and opportunity for me to give my presentation. This presentation is good for me and also for you as well. Seriously. For me, this is my first time to attend this meeting. Thank you very much. I'm one of those newcomers. I wonder, though, what kind of fun I've missed for the past 14 times, but I'll try to catch up. Also, this is my first time to visit this country, Norway, and the city of Oslo. What a wonderful city. very clean, safe, friendly people, and a great public transportation system. Kind of reminds me of Japan. That's where I'm from. So I feel like, at home. Now, for you, what is so good about this, my presentation? Don't worry, I'm not going to give you any yoga move or synchronized swimming lesson. As a focal point of these three indicators, I get asked questions quite often from NSOs, National Statistics Offices. They're saying, look, our SDG indicators that I know we compiled on the website is different from what you have in the SDG indicators or UN. Is there something's wrong with me or UN? Well, you'll find out. At least I give you some hint. It's not going. Excellent, thank you. So as previous speakers named their indicators, I think it's too mouthful. So I try not to say any numbers associated with my indicators. Instead, I'm a macro economist. I like to have a broader picture, big picture. So with those three indicators, I kind of create this chart to tell you some story. In case you haven't noticed, in the center is the government, our wonderful government. What do? They spend on things that are supposed to be good for the people. To do so, right, you need to raise funds, usually in the form of revenue, whether you like it or not. Usually the most major component of revenue is in the form of taxes, right? But if you need more money, right, you can raise revenue by non-tax sources, like a social contribution grants, right, or some investment incomes. So I tried to create this to tell a story, right? Let me take an example of Norway. You know why? Because we're in Norway. So Norway spend a big on essential services, right? Education, healthcare, social protection, but relative to other countries, right? Even compared with peer advanced economies, right? In exchange, what you can get? Higher taxes. I don't know how far the income tax is, but I know that you spend a lot of taxes on goods and consumptions. Boy, restaurants are expensive here. Now, if you don't have taxes, right, to finance other social spending, what are you going to do? Well, you raise social security contributions, right? That's another form of taxes. So you can tell a story, right, by combining these three indicators. I'm sure you can do that for other countries as well. One thing before I forget, so the source data for these indicators are coming from government finance statistics database. And you wonder, what is GFS? Oh, it's going back. So let me start with I'm so wonderful. Thank you I'm coming here and okay, I'm sorry, I'm only have 3 minutes. All right, I have to zoom. If I can move on. Okay, so what is GFS? So we know the SNA, System of National Account, right? It's the mother of all the other macroeconomic statistics. And we have sub international standards focusing on different sectors. So GFS is focusing on the government sector. Okay, so what's good about the GFS? Well, if you compile based on the latest manual, which is aligned with SNA, well, the data are standardized, right? Because we use the same methodology, but it's consistent within a country over time and comparable across countries. Good. So we produce SDG indicators based on GFS production cycle. So we start with the country source data, right? And then we compile based on GFS methodologies, And then member countries report to us, and then we validate, right? And then we have a kind of GFS database. And as you can see, there are like many tables, right? Not many kind of countries in the report, all 9 tables, but we take kind of 4 or 5 data series, right, to create our 3 GFS indicators. Then that's around September through December, and then we're gonna compile finish production of GFS by in February, and then we produce those 3 indicators, right? And then around March we submit it to UNSD by guess what? SDMX. And I'm not doing SDMX. My colleague is doing it, so don't ask me any questions about SDMX. But I'm going to turn the question to Heather, who is going to turn into Abdullah. Right. So in the end, you get to answer the questions. Right. So if you hear this until now, then you might think that GFS is perfect. As in life, nothing is perfect. We have kind of challenges. I have got 2 shortcomings. One is country coverage, right? Those are in the map, gray. They're not reporting GFS, right? Especially it's concentrated in certain areas. Also, another challenge is that not all countries report general government level, which is most comparable across countries. Some countries are only in a smaller sector. And then I forgot to mention that usually ministries of finance report the GFS. Okay, so if you NSOs and then Ministry of Finance don't talk to each other, then you don't know what they're doing, and then this might be a cause of discrepancy, right? If SNO is reporting their own data from source data, but Ministry of Finance, they go through GFS framework and it has a different outcome. Last slide, and I'll shut up. How IMF is doing to address those major shortcomings, right? We have been doing capacity development work, right, in many areas, not only in statistics, but in terms of statistics, and especially GFS, on an annual basis, on average, we have about 200 bilateral country missions, and also 30 workshops. That's kind of a classroom, style format. Participants come in, and then we teach and then try to give a hands-on exercise. And then they're delivered from our headquarters, which is Washington, where I'm living now, and also there are 17 regional offices as well. So if you need any help, please let me know. We'll do our best to accommodate your needs, subject to financial and human resources. One last thing, I'm sorry, since we are in Norway, the government Norway supports IMF CD work financially. I know that other countries does that, but I just want to mention that because we are in Norway. Thank you.
Thank you, Mr. Osawa, for this presentation. I can confirm that the availability of this data are depending indeed on a good collaboration with the Ministry of Finance. And if you don't have it, then you are having unsatisfactory or insufficient data reporting. So our last presentation within this session would be related to the progress on indicators 561 and 562 on proportion of women who are making informed decisions on sexual reproductive health, and the countries who have legislation and procedures on in this field. So our colleague Mengjia Liang from UNFPA, you have the floor. Thank you.
Well, thank you so much, Chair, and greetings, colleagues. This is not my first time in the IAEG-SDG, but still one of my favorite events. Okay, so let's switch gear to talk a little bit about SDG 5, which is our gender target, gender goal. So as you know that the 1994 International Conference on Population and Development, ICPD, and this program action put human rights at the center of the development. It recognized that sexual and reproductive health services must be guided by human rights. And they also have an emphasis on the population. So emphasis of the human rights of individuals and couples. So we switched the language from population controls, population issues, from an emphasis on the population numbers to an emphasis on human rights. And since then, there has been a lot of achievement in implementing the human rights-based dimensions of the program of action. In particular, there has been a growing normative framework on sexual and reproductive health and rights. And I would love to say that SDG Target 5.6 is actually one of the greatest achievements that we have done. It's a major milestone. This is the first time an international development framework includes not only target on sexual and reproductive health services, which we can see under the Target 3.7, but also our target address the barriers and human rights-based dimensions of sexual and reproductive health and the reproductive rights. So as you can see the language on the screen, so I'm not going to read it. This is our target 5.6. It's really about ensuring universal access to sexual and reproductive health and the reproductive rights. And this is measured by two SDG new indicators, actually new indicators proposed for this target, SDG 5.6.1 and the SDG 5.6.2, for which UFPA is their custodian agency. So of course, we are not doing this alone. So we have an expert group supporting the work on the methodological development back a few years ago. And we have very active collaboration with other UN agencies, but also with multi-stakeholders from civil societies and academia. So this is just a little bit about the work we have done to measure this target. So as I mentioned at the start of the SDGs, both indicators are tier 3 indicators, right? So there was no internationally agreed upon methodology, let alone data collection. So we are able to, during the past years, we're able to upgrade SDG 5.6.2, which is about law and regulations, to a tier 1 indicator. And so far we have data for 153 countries. And for 5.6.1, which is a population-based measurement, which of course is more challenging. Population surveys are very expensive, as we all know, and the data collection only happens every 3 to 5 years. So, but we still managed to collect data for, as of this year, 69 countries, and we are quite proud of that. And this is, on the screen, you're gonna see that those are the work that we have been focused on. We have 3 pillars of work. The first one is methodologies, data collection, and capacity strengthening. The second is research, knowledge management, and thought leadership. And the last one is data for action. We not only want to collect data, we want to put data to use. And I will speak a little bit more about our efforts on increasing data coverage of 5.6.1 in the later slides. As we talk about data coverage so much in this meeting. So what exactly is SDG indicator 5.6.1? So this is a composite indicator. We measure 3 aspects that are very core for women's empowerment and agency in the sexual and reproductive health areas. So the first one is reproductive health care, whether women can make the decisions about her health care for herself. The second one is contraceptive use, who usually make the decision on whether or not use contraception. And the third one is about sexual relationships, sexual relations. Can women say no to sex if she doesn't want to? And only woman says yes, qualified yes, which means participating in the decision-making on her own health care, participating in the decision-making on use or not use contraception, and say no to sex will be qualified as a yes for 5.6.1. Sorry, I forgot to switch that slide. This is the 3 components, as I just mentioned. And those are the exact questions that anyone can include in their household questionnaire. So as I mentioned earlier, we have done a lot on efforts to increase the data coverage. The latest count is that we have data for 69 countries covering 46% of the population coverage. So we have issued a very clear, technical guidance on how to collect the data for your country and what type of surveys will be the best, instrument for including those 3 questions. We have worked with the international survey programs like DHS and MIX, or regional survey programs like the Generation Agenda surveys to include those questions in their standard questionnaire. And also for those countries who are not part of those survey programs, we work with them closely, try to advocate for having those questions in their country-specific surveys. And we're also trying to be very creative because we noticed that even though with our best efforts to reach to those countries, sometimes countries actually, adopt those guidance organically, and they just include those questions in their surveys, like, for example, some of the violence against women surveys that we are not aware of. So we are also plan to do a more systematic assessment of the NSO's website, just to make sure that we include all your data in the global database. And we also work very closely with our USD colleagues to create an international survey calendar. So we know that what surveys are upcoming in the next 3 years, and we can do some more targeted outreach and support. So here's the latest data. So globally, only 56% of the women aged 15 to 49 who are married in one union are able to make decisions about their own sexual and reproductive health and rights. And this is based on data from 69 countries. And if you look at the regional data, you'll see that there's great regional disparities. And for example, for sub-Saharan Africa, we only 38% of the women can make those decisions. And if you break down the type of decisions, you'll see that, for example, say no to sex is probably the most concerning area of the 3 sections. Okay, so let's talk a little bit about SDG indicator 5.6.2. So this is the indicator about the laws and regulations in countries, how supportive the legal environment is on women's exercising their SRHR agencies. So this is, again, a composite indicator. We have 13 components clustered in 4 sections. And those are the parameters defined using the ICPD, the program of action, but also in addition to the human rights principles. And this is guided by our EGM, as I showed before. So the 4 sections are maternity care, contraception and family planning, CSE and information, as well as HIV and HPV. And let me talk a little bit about data collection. So the data actually collected through the UN Inquiry on Population and Development. This is an official tool run by the UN Pop Division since decades ago. So we try our best to reduce the burden, the reporting burden from the countries. We fully integrate our questions into this tool. And the data collection happens before it's every 2 years. Going forward, it's going to be every 4 years because laws and regulations do not change very frequently. And as you can see that every component, we assess the positive laws, which is whether there's a law exists to support this specific area. In the case of the example is about maternity care, and if the country says yes, we move on to the assessment of the pre-legal systems as well as the barriers, as you can see on the screen. So on the data availability, so 5.6.2 is a tier 1 indicators. We have 115 countries with full reporting, allow us to calculate 5.6.2 data. We also have 38 countries with partial data, so we don't have full data to calculate 5.6.2. However, we report whatever data we have, on the sections for components if the country provide the full data. And this is the latest data as we can see. Again, a great, variations in the component, and not very surprisingly, abortion is the one with the most restrictive legal environment. I wanted to share some very exciting update from our side because in March this year, we have started our first expert group meeting on forward-looking measures on sexual and reproductive agency. So why we are doing that? Because we know that
target 5.6 is a new target. Those two indicators are new, and we have learned a lot of lessons in the past 5-6 years since the SDG measurement. And there's still a lot of different terms being used to describe this area, bodily autonomy, sexual agency, sexual autonomy, reproductive autonomy. So we figure it's time for us to just get a multi-stakeholder process started, really engage our countries, listen to you, and engage our, researchers, top-notch researchers in this area. Hear from civil societies. That's why we started to have this meeting. And they're very happy to report that we have already made a first step, which is agreed on what is the term to use. And the term that the expert agreed upon is sexual and reproductive agency, which is really exciting because women needs to have this agency to exercise their rights. And if we look at from an ecological framework perspective, having the enabling environment and individual level decision making may not be enough to support our target. We need to look at the norms. We need to look at the social level norms and cultural norms. We need to look at economics. We need to look at, even from the health provider perspective. So there are lots of things we need to dig deeper. And some of the lessons learned is that we really need to advocate for more data use and use the data for advocacy, use the data for programming, and then make sure that their country level dialogues can happen to make the country use their data for the internal processes. Yeah, so like I mentioned, just looking ahead, I think we are just really excited to start this multi-stakeholder processes. We have already started the advocacy. We have had a very successful site event after this year's HLPF. We're going to establish a TAG, a technical advisory group, of course, really listen to the leadership from the countries to guide us under I would say, I think I just learned a new term today, is the thematic monitoring framework on their target 5.6. So in the next era, we are even more robust, methodologically, and they're really reporting on this area and support the program interventions as well as advocacy. I'll stop there. Thank you so much.
Thank you very much, Mrs. Lang. I can say that in Moldova, we have conducted the Gender and Generation Survey one time, and we're preparing the second round. So I am happy to say that the results of the first round have been already used for the policy making in the respective field. So I would encourage the other countries to also join the UNFPA initiative and collect this kind of data so that we could complement the data availability for SDG indicators on SDG 5. And now, thank you very much for the presenters, for your interesting topics and the results being presented. For sure, we will have more data soon on all of these 4 goals. And now we still have 12 minutes for questions from the audience. Would you please address your questions to our speakers? Yes, please, from our colleague from Ghana. We will collect them and then respond. Yeah.
Thank you very much. My name is Omar Seidu. Yeah, my question is on the illicit financial flow. I know the IAEG already has an established protocol around admitting indicators to be used for monitoring the SDGs, especially on tier 1, which is almost the same for tier 2, which looks at 3 things. Sound methodology. More than 50% of countries produce data on the indicators regularly, and 50% of the populations of countries or the regions that the indicator is relevant to produce data on that. Given that the submission says that developed countries are not willing to provide data on this, unless maybe I didn't get it right, but my understanding is that no country in the global north is contributing to the measurement of that indicator. So if that happens, we are not undermining the established norm for accepting SDG indicators. Thank you.
Thank you. Do we have some more questions?
Thank you. My question is to, well, it's question comment to the colleague from UNCTAD. We have a large government finance statistics unit, and I know on our own SDG data hub, we report those 3 statistics. So I'm wondering, you said it usually gets reported through the Department of Finance. Is there any reason why it has to be reported through them and why you could not come directly to the NSO? Because we have that data, we are the ones who produce it. Thank you.
Comment. Thank you for your very interesting presentation. It's not the best example, but having information for indicator 1641 with the support of UNDC allowed the Ecuador to have important information for decisions making on such sensitive issues as illicit financial flows. It's a comment, but this demonstrates the importance of the support of the agencies for the reporting of SDG indicators. Thank you.
Thank you. Are there any other questions? Sweden.
Hi, thank you. I have a question for UNFPA. Is it? I can't really see. Yeah, sorry. Yeah, this is just on the margins. I think you said that you will be looking for data on the NSO websites for 5.6.1. And I would strongly advise that you also ask NSOs, or because the data is often on other agencies' websites. So so that we can direct you to the right place to look, or for a contact person to reach.
Thank you. So there are no more questions, right? There.
Sorry. Is your agency you speak about considering the surrogate maternity? Do you consider the problem of paying women for children, the paying? Do you surrogate maternity? People, maybe men pay women to have a children because they don't have a female, they don't have a wife. What about that?
Okay, we got it. Thank you. So I guess I will ask our speakers to answer to the questions. So the first question was from Ghana on illicit financial flow.
No, I can just to reassure you. No, I just wanted to reassure you on what you mentioned of the northern of the illicit financial flow is universal. And so, I give you an example that, for example, we are now working to estimate the illicit financial flows relating to heroin and methamphetamine that will include all of Western Europe. So just to reassure you, if I may just do a comment on the criteria, and I understand the criteria of the that the group has established, but I'm wondering also within the criteria, it would be also important to have the percentage of the phenomenon, because when we talk about illicit financial flows, for example, I show you some of the countries where, and thank you for the comment from Ecuador to know that is useful. For example, the countries that there are only 9 countries, but probably they cover, I would say, 50% of the cocaine illicit financial flows related. So, sometimes this kind of a proportionality that definitely have to be there, maybe can also be considered in the context of a phenomenon, rather than just only on population. But that's just a comment.
Can I just yeah, I just want to add, for clarification purposes, as Angela has said, illicit financial flows are a global phenomenon and a global problem. There was, let's say 5, maybe 10 years ago, a perception that illicit financial flows are a problem of developing countries. But illicit financial flows, by definition, are cross-border flows, which means if they're being resources drained from the developing countries, they are accumulating somewhere else. And illicit financial flows as an SDG indicator have two parts. One is the inward illicit financial flows. So these are the flows that are coming into a country, and the outward illicit financial flows. The outward, I think we all kind of immediately grasp, okay, that's a problem because we cannot dedicate those resources to, let's say, development challenges. But the inward are also problematic because they fuel corruption, they undermine institutions and so on. So both are problematic. The reason why developed countries are not covered in our work is, one is a technical part. We are working without resources, both of our agencies, and with the UN Development Account projects, by definition, these have to be addressed to the developing countries. We have asked some of the developed countries whether they would be willing to test some of the methodologies, and some of the countries have been doing this. Italy, Ireland, Finland, they have been part of the international task force. They have done it, but only to a testing phase. They never went further than that. This is a challenge that we have to address to essentially convey the message. It has to be estimated also in the developed world. Thank you.
Thank you. Yeah, so Kara, I suppose your question was addressed to the IMF colleague, not to, yeah, okay, thank you.
Yeah, exactly. Would you like to answer? Right. The question was, so SNOs, right? You know, they're in principle responsible for producing SDG indicators, correct? But you know why on the earth, you know, IMS, you know, coming into this field? I think this is a question about institutional memory. I'm not that old. I mean, I'm old, but I'm not that old in terms of you know, compilation of you know, SDG indicators. So I think there's correct me if I'm wrong. You know, Heather, I think you might have like a you know, wealth of you know, institutional memory. This is not about the SDMX, so you know, you can you know, pass that on to Abdullah. But I think that the main reason I suspect is that not to duplicate you know, our work, right? Because you know, GFS data was already there, and then all the data series needed to compile those indicators are you know, there. Also, GFS is based on international standard, you know, comparable, consistent, right, and you know, standardized. Why you know, reinvent the wheel? I think that is the reason. And then I like to mention that I said that I'm not going to say the number, but indicator 1.8.2. That's you know, a spending on essential services. I like to acknowledge you know, UIS. Hi. So it's you know, we are you know, a core custodian for you know, education spending. Initially, you know, UIS were producing only an education component, but you know, if you look at the you know, SD, there's so many acronyms. GFS, you know, our database. We have you know, two other components of spending, health and social spending, as well as education. So we are asked to be you know, custodian for the indicator. I hope that answered your question. More or less. Okay. Well, we have to go to Heather for deeper institutional memory. Thank you.
Thank you very much. And Ms. Young, do you have some comments?
Is it working? Okay, great. Well, thank you so much for the comment on surrogacy, if I understand you correctly. So in our EGM, I think we had a lot of discussions about, you know, what should be considered as sexual and reproductive agency and what should be considered as sexual reproductive violence and sexual reproductive coercion. So I think there are fine lines in those different areas. We don't want to claim everything is agencies. There are certain issues may be best fitted in some other SDG target. So we are focused on target 5.6 here specifically. I think that being said, we are, you know, working with the TAC members. We are trying to produce our
conceptualization framework on this issue. And I think in that process, we will have an open call just to hear everybody's perspective. And we are very much interested in continue this discussion and maybe engaging our human rights and gender experts as well. But thank you so much for your question.
Okay, thank you very much. So these are all our answers to your questions. So I would like to thank once again to our speakers for the presentations, to the audience for listening to us and for putting the questions. So we are expecting you tomorrow to continue this storytelling on our progress from the country experience, from the custodian agencies experience, and we are looking forward to meet you tomorrow at 9 a.m. and please be in time. Thank you.
Thank you.
Have a nice evening.
Hey, Paul, you close it? Hey, Paul, are you there?
Okay, I'll end it.
Okay, thank you.
Have a good evening.
All right, talk to you later.
Bye.
Bye.
Hi, dear. Can I send you?
Oh,
I'm so in the park
no,
tomorrow.
you cannot. No, actually, are you late? No, 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 no. I